So if you're preparing for the MSRA, just want to tell you about our MSRA Crammer course bundle. What does it include? 2 full days of live intensive teaching. So day 1, we're going to look at over 100 clinical topics. We'll do a full clinical mock to timed conditions. We'll look at exam technique. We'll cover lots of guidelines, especially ones that have changed recently, so you're up to date with the latest information. What it's going to do, allow you to consolidate key topics and improve your exam technique in a very short amount of time. Day 2, the full day, is all about the SJT. So we'll look at the different types of SJTs, the domains that are being assessed, exam technique, which is hugely important, how to map the different questions to the different domains, how your approach should be completely different for section 1 ranking questions compared to section 2. And we'll also cover the important GMC and ethical guidance and how to apply it for some questions that can make a really big difference. Alongside the live sessions, you get access to the recording for a standard ticket for a month afterwards, for an extended ticket for 12 months afterwards. For both options, you also get access to the question bank. So our question bank's got over 2,380 questions, both clinical and SJT are covered. There's full-timed mocks for both papers. So who is this course for? There are a few different categories of doctors that might suit this course. Not everyone needs a course. One example is if you've always struggled, or if you're less familiar and less confident with SJTs and you really want to get a handle on it, the teaching on day 2, which covers the SJT in huge amount of detail, especially exam technique, will be ideal. If you're someone who really wants to excel in the SJT, or that's something that you're less confident in, that's one group. Another group it might be helpful for is maybe you've actually sat the MSRA before and you might already have a decent score, but with the level of competition recently, even people with good scores aren't always getting an interview or getting the job that they want, and you want to improve. So you're very familiar with it, you just want that extra boost. Another group of people that will find it helpful is you're applying for a really competitive specialty, and or you're applying for popular areas, or because of family circumstances, you're limited to the areas you can consider. So you need the absolute best score possible. So just to recap, it's your first attempt, but you know that you're applying for a really competitive specialty in a really popular area, or you're restricted to the areas that you can consider. So you just want the best score possible. You're resitting, you might already have a good score, but you need something extra to get the offer that you want. Or you're someone that wants to be more confident in your approach to SJTs. Either you're not that familiar with it, or you've struggled with them in the past. Finally, the last group is doctors who maybe haven't had the chance to make a start as early as they wanted to. And so now you want to cover a lot of material in an efficient way. If any of these apply to you and you'd like to join, I'll pop all the details and dates down below. Prepare and you will succeed.